Hey everyone. So I wanted to take a few minutes and share this work enrollment cheat sheet that I've made. And so there's a couple of ways you could use it. You could print it out and actually, fill it out, write the person's name, and then check off as you do the things. Or you could just download it and save it and then pull it up as you are working with someone. And that way the links will be live if you want to use those. But it was just kind of me thinking through how I do an enrollment, and so I just wanted to kind of give you this. If you're new, you could go by it and it would just be a way to help you work your way through an appointment. So, of course, you always want to kind of start out with a little introduction, find out the person's name, and then, usually they have called me. That's the way it works. They'll call our office. And so, the first thing I want to do is determine if they're even eligible to enroll right then. So, usually when you're talking to them, they'll tell you what's going on, if they are losing coverage or whatever. Of course, if it's open enrollment, then that's, a no brainer. You can enroll them during that time. But at other times of the year, you want to be sure that they have a eligibility to enroll at the time. So, it could be a special enrollment period due to a life change, or it could be a low income special enrollment period. And so, if you're not sure, there's a few ways you can know the special enrollment periods due to a life change. There is a chart in the ACA handbook. It's the SEP chart, and it's going to go over every qualifying life event and then the special enrollment period that it could trigger. So you may want to study that next month in February of 2020, March of 2025. We're going to have a webinar about those special enrollment periods and really dig into that. So be looking for that. And then the low income special enrollment period, there is a chart in the handbook. It's the poverty guidelines chart. And all of the incomes in yellow would be the incomes that would qualify for that low income special enrollment period. So you could use the handbook to learn more about both of those. Or if you just wanted to check real quick, this is a link to an eligibility checker here. It's from healthcare.gov. Let me see if I can open that link. And so, check before you apply, find out if you can qualify now. So you would put in a zip code, and then it's going to ask for a little bit more information. You can see if one of the life changes might be something that would qualify someone to enroll. Of course, lost Medicaid or CHIP, and then the income. So either way you want to do it, both ways are good. So I'll also put a link to the family glitch calculator, and that's something we'll talk more about in the upcoming webinar. If someone, we'll talk more about the family glitch too, but if someone has the family glitch problem, like if their employer family coverage is unaffordable, then they can disenroll from their family coverage, and that will, due to it being unaffordable, and that will trigger a special enrollment period. So when you're talking to someone, if they say, well, my family coverage is so expensive, then you could use the family glitch calculator to see if they would qualify that it's unaffordable, if their family coverage is unaffordable. And we'll make another video about that, going into detail more about that. That's sort of a separate topic, but you may need to use that here at this point in your introduction to find out if they're eligible to enroll right now. And once you find out if they're eligible to enroll, if they are, then you'll want to move on to generating a quote. And here's a link to a video that would help you with that if you're not familiar with how to use Health Sherpa to generate a quote and save the lead as well. One great thing that I love about Health Sherpa is as you're generating the quote, you'll have questions. You can just basically follow it, like, is the person a tobacco user? And those things are kind of underlined, like with the dotted underline. And if you hover over it, then you're going to be able to get a definition of like how many times have they had to use tobacco to be qualified as a tobacco user. And so be sure that anything when you're doing that quote, just hover over those underlined words if you're not sure what something means. That Health Sherpas made it very easy for you to do that quote. And of course, you'll see if they get a cost share reduction. You'll see if they qualify for a premium tax credit. If they do qualify for the cost share reduction, remember that only applies to the silver plans. So then, you would want to just go down and look through the plans, discuss the benefits of each plan. I put this note on here again. I know I sound like a broken record, but those select plans, the standardized plans, the Saver Silver plan, you have to have a primary care doctor in the select network, and it has to be designated in order for that plan to pay for anything. So here's the provider directory. If you want to look up their doctor, make sure if that's a doctor they really want to see, then they may need to choose the value plan. If it's not a doctor, if they're not worried about what doctor, then they could, or their doctor may already be a select doctor, so then those plans will be fine for them. But you do need to verify that, and you can use this link to do that. And there's also a YouTube video that explains a little bit more how to use this provider directory. And so once you've gone over all of the plans that you think might be best for them, then you can send them that quote through an email. There's a share arrow up at the top where you can share that quote with them. You'll need to save the lead as well, so that when they call you back, you'll already have all their information entered in. And I did want to say, if you have trouble figuring up their income or their household size, refer back to the handbook in the chapter about household size and income. You'll know what to count and who to count. Just refer back to that if you still are new and you're having questions about what you need to put there. But, this is sort of the middle part. You're generating the quote, you're comparing the plans, and then you're saving the lead and sending the quote, letting them look it over. Sometimes I send it and then they call me back and we go over it together because it's a little easier for them to see the same thing I'm looking at. If we're in the office, of course, I have a cord where they can see it on the TV monitor when I'm seeing on my screen. So however you want to do that would be up to you. So once you've kind of done that middle part, you've gotten the quote and gone over the plans. If they decide they want to enroll, then you would continue on to the application. And if you're not sure about how to do an application on Health Sherpa, here's a couple of videos that will help with that application process. But you'll just complete the application. And remember, again, hover over those underlined words. If there's something you don't understand in that application, hover over the words. It will usually give you a little bit more information about it. Sometimes there's like a little circle with a question mark out to the side. Click on it. It'll give you more information. So Health Sherpa tries to make it really easy for you to complete that application. But anytime if you run into trouble, call this Health Sherpa agent support. They are very helpful and are happy to help you. So be sure that, if you do have trouble, you call them. All right. And so then once you've completed the application, and if you've not, I hate to keep going back, but if you've not watched or looked in the handbook about getting consent, you're going to need to make sure you do that. Okay. There's 2 places in the Health Sherpa application for you to gather consent, and you'll want to be sure that you get both of those. So if you're not sure how to do that, look back in the handbook in the Health Sherpa section about gathering consent, because you'll need to have both of those documented. And there's also a video on Health Sherpa on their training videos. There's a whole a webinar about gathering consent, and it's great. So in the resources webinar, you could click on the link to the Health Sherpa videos, or you can go up to the top right hand corner on your dashboard and access the videos there. But if you don't know what I'm talking about with the consents, or you're not sure how to gather those, watch that video, because that's extremely important. You'll want to gather those consents and as you're completing the application. Okay, so once you have completed the whole application, you've got them enrolled in a plan, then you're going to be asked about the payment information. And I know that's been a problem. We've talked to Blue Cross about it, and hopefully we're going to get some of those kinks worked out of that payment process and get it to where it's a little easier for us to take the payments. But if you do take the payment, be sure to write down that confirmation number that it gives you, because then if there's a question about the payment, or it doesn't get through, or you're still seeing it as unpaid, you'll have that confirmation number. And if you need to contact Blue Cross, it will be important to have that. So be sure you write that down. And then I always put it in the notes section on Health Sherpa under that client. Now, the last thing I usually do, well, not the last thing, but the last part in this process, is I either email or I print out the summary of benefits. If it's on an email, sometimes I print out that I will email the whole 80 something page document, but most people don't really want to read that much anyway. So just that shorter summary of benefits with the questions, like, do I need a referral to see a specialist? I print that out or I email that to them, and I kind of go over some of those things with them and make sure that they understand how to use their plan. And I didn't talk about drugs, because that's usually, most of the time, you don't have people that are taking a whole lot of medications that are enrolling in these plans. But if you do run into that, refer back to the video on YouTube about adding drugs, because there is a way for you to look up the drugs and see what their drugs would cost. And so that's in that video. So that would be important, that you've gone over that with them as well. And on that summary of benefits, it will explain the tiers, and then, how much each drug would cost in each tier, and then about the pharmacy network as well. And I talk all about that in the YouTube video. So, you just want to make sure they understand what they've enrolled in and how to use it and what different things are going to cost. And then as I wrap up, we've already talked about their primary care doctor. And if I've enrolled them in a plan that requires that select primary care doctor, then I go ahead and I complete this PCP designation form for them, so that they, don't have to worry about that. I've got it submitted for them. And then I record that in my notes on the Health Sherpa page. So, that's something I would just suggest you do, and that way you'll know you have it. You'll know that's been done for them. And then finally, sometimes you'll get the notification that they need additional documents uploaded. And if they have those documents available with them, I go ahead and I just get that done right then. It just makes it easier. You're not having to try to get back in touch with them later. So if they have that, I try to get it right then. If not, I make myself a note to follow up with them. And if you're not sure what documents can be used to verify these things, there is information about that in the handbook. So just look up those documents that you can use to verify citizenship or income or social. Well, obviously the social security number would be the social security card, but just look through that if you're not familiar with that. So, this is just something that I thought might help you, especially if you're a beginner. Just walk through an enrollment process and help you to not forget anything. I know when I was new, all of this did not come natural at all. So it was just helpful to have sort of a check sheet to help walk me through that. So I hope that'll be helpful, and thanks for your time. Have a great day.